The COVID-19 pandemic has been a constant reason for worry for many of us. Many of us are looking for answers to some of the most pressing questions centered around the pandemic. Here's introducing a brand new series, Bounce Forward, where we bring to you stories of truth, facts, and resilience. Here, we break up the most complex issues into the simplest explanations and help you understand and comprehend COVID-19.
Hi everyone, we'll be discussing children during the pandemic, and we have with us Senthil from APD, Sonali from Sesame, and Deepa from CSI. So I will just quickly dive into the questions. How do you think the COVID-19 pandemic has affected children and their education, considering almost a year of schools being shut down? Sonali, would you like to begin?
Thank you, Tanya. Just to say that nearly 250 million children have been impacted by the school closures. And these are just talking about children in preschool and elementary. Yeah, so it's a huge number. And reports coming in show that both in terms of numeracy and literacy, children have not just fallen behind, but they've also forgotten what they have learned. So we are dealing with learning loss in a very complex manner. And if you think about it, they have, especially again, if you overlay it with a socioeconomic lens, children of, weaker economic section have even struggled more in terms of access through either some kind of a digital format or classroom, distance classrooms. So overall, the impact of COVID has really been very significant on education.
Thanks, Sonali. Senthil, could you bring in your perspective in working with the children with disabilities as well? What has been the impact of the pandemic in terms of early interventions or assessment of developmental disabilities?
Yeah, so when you talk about children with the disabilities, I can say that they are doubly handicapped with several informal barriers. When you talk about either of the IQ of the child or the observation and the support provided by the teachers or the child's functional abilities in terms of reading, writing, or speaking, or even operating the device, even if the device is present, operating the device and focusing on the device for the classes are all very difficult. And we also understand from the parents that the child is completely dependent on them for accessing the online education, even though online education here and there is possible in certain places. And third, what we also understand from the parent perspective is that parents were found to be completely helpless and anxious, and sometimes they are exhausted due to their increased responsibility, both in house as well as shifting towards the online education. When we did a survey, we understand that almost 75% of the parents were also not comfortable to resume the school because, they have a heightened fear of sensitivity towards the children towards the COVID pandemic. Yeah.
Thank you, Senthil. Deepa, would you like to take this question again next, bringing in some perspective from gender gap or digital divide in rural and urban India as well?
Yeah, COVID-19 severely impacted the education of children, and as Sonali also touched a little about it, that it has severely impacted in terms of there's a digital divide in rural urban as well as in you can say between different income levels, because in India, if we see the broadband penetration, it is only about 29% in rural areas, and rest of the country, they did not have any access to online education. And not only the broadband access, they did not have access to gadgets which they can use, the low-cost mobile phones. So that is another thing. And if we see within the family, if we see, there is a divide, there's a gender divide. Even if there is a phone that is more accessible to the men and the boys in the family, and women and the girls, they either did not own their own phones or they did not have access to it. So all this impacted the education of the children. And many of the children in our country, they've been going to the schools because they could get the midday meal. So when the school closure happened, they did not get those midday meals also, and that has also impacted the nutrition status of the children.
My next question would be, what are some systemic challenges that your organization and the vulnerable children that you work with have faced? Would it be right to say that there has been an increase in school dropouts in the last year?
When I talk in terms of systematic challenges, one of the things that we observed was that the schools did not have the updated data about how to communicate with parents. Many of these schools, they did not even know whether parents they had a basic or an Android phone, and then the phone numbers that they had, they were also not updated. So that was one of the key challenges that the schools themselves faced in getting all the children connected to the education. So when even organization like ours went to them and we said that maybe after 2-3 months, when we said that our field workers will go out into the field and will make home visits and will try and connect the children, we realized that even the addresses were not updated. So that was one of the biggest challenges that we faced. And if I talk in terms of dropout, many of the families, they migrated back to the villages. So the children were not in touch with the schools. Because of the family situation, because of the income losses that the families faced, many children were forced to contribute economically to the family. So some of them took to working in shops, working as domestic helps, or even working in farms in rural areas. So these are the kids who are more likely to drop out now when the schools are opening. But as per RT Forum, if we talk only in terms of girls, about 10 million girls are going to drop out at the secondary level. So the impact is going to be huge. We are going to see huge dropouts, but exact figures we will know in the next 1 or 2 months.
Thank you so much, Deepa. Senthil, would you like to answer this question as well in terms of your systemic challenges?
So I would like to put the challenges into two categories. One category is more about the organizational capacity of challenge. For example, like when it comes to children with disabilities, one is that the teaching learning material for online education is not one of the challenge, one of the biggest challenge I can say. The second challenge would be like the capacity of the teachers, particularly if you talk about the special educators or the community workers. Access to technology and the usage of technology was actually lagging. It's not 100% because they are not tech savvies. And the third part I would like to say is the capex funding for organizational infrastructure upgradation, because most of the funds has been diverted to COVID. Even in case if you're raising funds, looking for a capex fund was very difficult at this point of time. And fourth point I would like to say is the supporting devices. Whenever we are raising funds to support the devices for a child with a disability and the family, there is a lot of challenges in terms of the ownership of the device, maintenance of the device, capacity of the parents to operate the device, and so on. And even when we actually deliver the education through online, the monitoring and evaluation when it comes to the input outcomes and outputs are not the routines. So there was another difficulty as far as organization is concerned. Whereas when a child with a disability is concerned, we had multiple challenges. One is that setting up a common schedule is very difficult, because there you see that when it goes to learning from home, there is no routines has been followed, not like a school kind of a routine. That was another challenge. And then even the device with a strong internet connection and a good webcam and a mic was a big issue. As we all know, when it comes to children with learning disabilities, ADHD and mental retardation, they have suffered a lot compared to locomotor children. Those are the challenges which we have faced.
This brings me to my next question. How important do you think it is to provide psychosocial support to students and parents? What are some measures that have been taken for the same, and what could be the way forward? Sonali, would you like to take up this question in terms of parenting in this day and age?
Yeah, this I think is a very, very critical and important question that we need to ask and answer, particularly in light of COVID. Very early on in around like April, May of 2020, we as an organization really started addressing the issue of social-emotional well-being of both parents and children. We launched a global campaign and initiative called Caring for Each Other, where we really put out material. And I think it was very much not just for children, but for parents. One thing we realized that both parents and children in lockdown are facing enormous amount of stress. And, regular work, the way we were leading our lives had completely changed. And there was no way that a parent who was facing loss of livelihood and other such challenges would be able to take care of a child adequately. So all the material that we put out was both addressing the issues that parents and children were facing and how to collectively look at the family well-being and resilience. So that's the first thing. The second thing, as we are seeing the impact of COVID roll out with, not just loss of livelihood, but dear ones and family loss and the kind of grief they have been facing, we've had to see children really mature and grow very fast. So how do they handle all of this? How do families handle all of this? So we've been very actively trying to see how we can address this. So socio-emotional well-being has been one of the key areas of focus for Sesame Workshop. And we have been both using every kind of platform, whether it be community radio, WhatsApp, YouTube. We've been having, we've been doing webinars. We've had several conversations around this to really reach out messages. And you must remember that we are a country where we have been in strong denial on issues around mental health. And I think one thing that, if I can say, the silver lining of this is we've started acknowledging that this is a big problem. Not just the world, WHO has said it, everyone is saying it. More than anything else, the issues around mental health is very significant. And we as a community need to start addressing it. And I think it's about, the last point I'll make is that it's not just about in family, it's about in school. Teachers don't know how to deal with children. They are not prepared. So we have to really work at all levels, and Sesame is doing this, is not just looking at home, but seeing how we can really look at schools and better prepare teachers and equip them to deal with issues that children will have gone through during this period.
Thank you so much, Sonali. That was really interesting. Deepa, would you like to go next?
Yeah, many of the points Sonali has already covered, and I totally agree with her. What we also found was that we were all ill-equipped to handle the kind of trauma the kids have gone through, and also the adults, because the children had no, their restrictions were on play, on in the interaction with their own peers, and there was no physical contact with anybody. All these things which are very critical for their psychosocial well-being. And at the same time, the parents were also going through a lot of stress because of loss of livelihood, loss of loved ones, and they were in no position to engage with children or to explain the situation to them. So it was very important to provide psychosocial support to the parents as well as to the children. And we were feeling that our team is also not equipped to handle that. So one of the things that we did initially was to first train our own staff in handling this. So we trained our staff. We work with some MCD schools. We trained the teachers also, because these were the people who were in direct contact with the parents, so that their training was also important. So we did training for our own staff on psychosocial support. We did training of teachers, because our staff and the teachers were in touch with the families. They were doing tele-counseling sessions. So that was very important, that they need to be trained. We all know that 90% of the brain development happens before the age of 5 years, and these kids were missing out on such a critical period. So our videos were also talking about stimulation to children and also keeping them engaged, and also handling their queries. Many of these parents, they did not know how to explain things to kids in a very easy language which kids could understand. So that kind of support parents also needed, and it was very critical for an organization like ours to provide it at that time. And this is going to continue. As Sonali has mentioned, that we've all realized that this is one thing that we many a times neglected, but this is something that will now need to be given more focus.
Thank you so much, Deepa. Senthil, would you like to take this question as well?
So when it comes to child with a disability, if you see that they may express the psychological distress by a different way, like either they behave differently. Like sometimes the child may either go completely silent, or sometimes they will go to another extreme, that they express anger and hyperactivity. We actually, as others have rightly mentioned, that one is that the parent capacity building is the most important key when it comes to child with a disability. So we actually inform the parent that they need to have patience and acknowledge that any kind of an emotion, whether it is a positive or a negative emotion, all emotions during that part of the phase is actually a valid emotion. And there are certain things which actually we try to make them follow. Like one is that we advise them to keep regular routines and schedules as much as possible, so that the routines can actually make the child to move from one to the other. And one more important thing we actually said is that listen to them, comfort them, and reassure them that it is not, it is nothing going wrong. And third is that when it comes to, again, we also empower the parents to recognize the signs of psychological distress. That is important, because sometimes, the child may say that they may have unusual fear, or sometimes the child may say that they complain of stomach pain or headache or something without any kind of a physical reasons, which we don't understand. So we also actually inform them about what are the different signs that could actually come up when a child is in distress, and make them ensure that they need to give a quality time and make it very positive. And we also started, like when the attendance was very poor in terms of education, we also started something called as a dance therapy to actually engage the child towards play as well as towards dance, which can actually motivate them towards some kind of a physical activity. That has really helped some of the students to participate in a better way.
Thank you so much, Senthil. Thank you everyone for taking the time out today and participating in this conversation. It was really interesting having everyone here.
Thank you for watching the Bounce Forward series, brought to you by the COVID Action Collab. Bounce Forward brings to you stories and insights that have not been spoken about in enough detail and provides solutions along with relevant data to back them up. Like, share, subscribe to our content to get regular updates on all things COVID-19.